So CheckMate 227 was a randomized trial that included patients with stage 4 or recurrent non-small cell lung cancer and no prior systemic therapy for advanced disease. Patients with known EGFR mutations or ALK fusions were excluded, as were patients with untreated unstable brain metastases. And it did include patients with both squamous and non-squamous histologies. About 30% of patients in this trial had squamous non-small cell lung cancer. It's a bit higher than some other studies like Keynote 24, where it was about 20%. It's important to factor that in when you look at the numbers, as some populations do have a slightly worse prognosis. In the 3-year update, the median survival for the PD-L1 positive group was 17.1 months compared to 14.9 months with chemotherapy. That's a hazard ratio of 0.79 for death. The landmark survival rates favored dual checkpoint blockade. The 2-year OS rate was 40% versus 33% with chemotherapy, and the 3-year survival rate was 33% versus 22%. What I thought was maybe more compelling was the PD-L1 negative cohort, where that hazard ratio was better at 0.64. But the difference in hazard ratio for death, 0.64 in PD-L1 negative, 0.79 in PD-L1 positive, is primarily due to the performance of the chemotherapy arm. The Nivo-Ipi arm was remarkably consistent when we compare the PD-L1 positive and negative. In the positive group, 17.1 median survival. In the negative group, 17.2 median survival. We usually expect a bit of a drop-off in the PD-L1 negative cohort. Didn't see that with nivolumab and ipilimumab. While chemotherapy was factoring in a bit worse in the PD-L1 negative group, nivolumab and ipilimumab performed consistently well.
CheckMate 227 was a large randomized phase 3 trial, and a major component of that trial was looking at the immune combination of nivolumab plus ipilimumab compared to chemotherapy. And the overall survival endpoint was the primary endpoint for this trial in PD-L1 positive lung cancer. And this trial made its primary endpoint. There was clearly an improvement in overall survival for the immune combination compared to chemotherapy that was both clinically and statistically significant.
In CheckMate 227, progression-free survival was superior with dual checkpoint blockade. Using nivolumab and ipilimumab compared to histology-specific chemotherapy, hazard ratio for PFS was 0.81 in the PD-L1 positive group, 0.75 in the PD-L1 negative group. The 3-year PFS rate, 18% among positive patients, 13% among negative. Response rate was also higher with just the nivolumab-ipilimumab combination at 36% in the positive versus 27% in the negative group. I think what was most impressive, looking at the outcomes in CheckMate 227, was the duration of response. In the PD-L1 positive group, that duration of response was 23.2 months, almost 2 years for a median duration of response. PD-L1 negative cohort, 18-month duration of response. These responses are remarkably durable. And I think when we consider the responses we're achieving with dual checkpoint blockade compared to, say, chemoimmunotherapy, when we're looking at chemoimmunotherapy, some of the responses we see are those durable immunotherapy-based responses, but some of the responses we're seeing are just chemotherapy responses, which are somewhat transient. When we're only using dual checkpoint, the responses we see are immunotherapy-based responses, and those do tend to be more durable. And the duration of response of almost 2 years, really quite compelling and difficult to ignore that.